Here we are in Houston with the snow coming down. We're already above what we had back in 2021.
A day that had Houstonians running for what passes as hills in these parts.
You can do it! I'm skiing Houston!
Happy Friday, Baylor College of Medicine and friends of Baylor. Well, it's snowing in Houston, product of global warming. You know, my banana plants are dying once again. So my sister's been after me, said well, what about me? That's what my sister says all the time. What about me? So you've been talking a lot of this science. What about me? I got some questions. So we're gonna do that's sort of a mixed Q&A and some science today. And this is because it came out in the New York Times. There have been 2 measles cases that came out in Texas, actually 2 in Houston. And this is a pretty classic story. 2 cases of measles in adults. They were the first cases since 2018. And these 2 people live in the same household and had a history of traveling abroad. And that's pretty much the way it happens. If you're not vaccinated and you travel abroad, you're going to be exposed to people who have measles. So they said in the newspaper, but they weren't really sure whether or not the 2 were up to date with their vaccines. And I can tell you, they were not, or they would never have gotten it. So let's return to, I've done this 1,000 times. We're going to do, well, not thousands, I've done this a couple hundred times. Let's return to why measles is so incredibly infectious. And remember the concept of herd immunity. So herd immunity is the level of immunity that is required to prevent the virus from spreading to everybody. If it's and the concept is that there's an R number, which is if I walk in and infect somebody, how many people do I infect? And so the R number, this is a classic. This is a visual. If this person's infected and they have measles, they will infect 18 people. That's an R number of 18. If this person's infected and walks in with its COVID-19, COVID-19 started off at 2, but quickly moved through mutations of the virus to 12. Polio and smallpox are 6. Seasonal flu is about 2. So the higher the R number, the more immunity is required by many people to prevent spreading. If it's less than 1, it always stops spontaneously. So that's just to remember. If it's 2, for example, the calculation, as Billy adjusts the view, okay, the calculation is because he wants a prettier picture of the outside of my dead banana plants. If the R number is 2, 1 minus 1 over 2 is 50%. So all it takes is 50% to reach herd immunity, or at least the immunity level at which the virus won't spread. That said, it's complete immunity. And so some vaccines provide complete immunity. Measles is almost one. And some are sort of kind of good, like the seasonal flu is about 70% effective. So that means that you have to have higher than even the predicted value for herd immunity. It has to be a little bit higher if you don't have complete immunity. So in an R number of 18, like measles, it requires that 94% of the population be immune. That means if there's just a few people who aren't participating in vaccines, the entire population is susceptible. And if you look at this, is an interesting graph that plots the mortality versus R numbers. So this is a highly serious infections like HIV. They're very high mortality, lower R number, versus something like measles, which is less mortality but very highly infectious. And if enough people get infected, you're going to see mortality. So another thing to look at, just from a graphical way to show it, these little signs means that these people are immune. It requires this many people, almost 95% of the population, to be vaccinated to prevent a measles outbreak. It takes about 90% to prevent a COVID outbreak, and about 83% to prevent polio. So when the people in the country start getting lax about their vaccines, or they haven't seen the disease in a while, the very first outbreak is going to be measles. And guess what? Polio comes back too. And we've seen polio now in 2 states in the wastewater. New York State and Illinois both have polio around, a disease that should be eliminated. All these are diseases that are could be eliminated. So let's talk a little bit more about measles. We talked about it a couple weeks ago, but before 1963, when the measles vaccine was available, there were over 100 million people worldwide who had measles and about 6 million deaths. In the U.S. alone, there's about 4 million, and we used to have 450 deaths a year. It's really important because even now, because there's not widespread vaccines across the world, even now, like in 2022, for example, there were 136,000 measles cases worldwide, and mostly they were among unvaccinated or under-vaccinated children. In the U.S., we did a great job until we started ignoring it. We were very good at, once the vaccine was developed, you can see we used to have 450,000 documented cases. The estimate was 10 times that, probably 4 million cases, but 450,000 documented cases pretty much eliminated with the development of the vaccine. In 1990, we had a couple of blips you saw in 70, 75, 90, so they decided two doses of the vaccine were required, and it was eliminated in 2000. The trouble is, as people didn't see measles amongst their peers, I mean, everybody I knew growing up had measles, but as people didn't see it, they said, oh, it doesn't exist, it's not important. We won't get our kids vaccinated. Well, it's come back. So the current state is that if you look at measles infections, 1 in 5 unvaccinated people who get infected are hospitalized. Pneumonia occurs in about 1 in 20. Encephalitis, which is a very severe complication, occurs in 1 in 1,000. It can cause deafness, seizures, and intellectual impairment. When I was a kid growing up, I had friends who had hearing impairment, some deaf from measles. Mortality is about 3 in 1,000, usually happens because of either encephalitis or pneumonia. And unvaccinated women who get pregnant can have premature births and low birth weight babies. So in 2024, just this past year, we had a total of 284 measles cases that were reported in 30 different states. There were 16 outbreaks compared to 4 in 2023. And an outbreak is defined as 3 or more cases. And most of the cases, 70% or more of those cases, happen in these little outbreaks. And in 96% of the cases, the people were either unvaccinated or under-vaccinated. In other words, had only one shot. And 40% of those cases were hospitalized. Mostly they're under the age of 5, 42%, 31% were teenagers, and 27% were 20 years or older. Now, this is a disease that should be eliminated in the United States. We've done it once, and now it's coming back because people aren't paying a lot of attention. So here are the recommendations by the CDC. All children should get 2 doses of the MMR, measles, mumps, rubella vaccine, starting with the first dose at 12 through 15 months and the second dose at 4 to 6 years of age. Students who are going to college or going to some other educational programs that are post-high school, if they don't have a lab test that confirms that they are or don't have a record of vaccination, need to be treated just as though like they don't have vaccination. So they should get 2 doses of the MMR vaccine separated by at least 28 days. And adults who do not have presumptive evidence, that is a history of getting measles or a lab evidence of immunity or a history of getting vaccinated, should get at least 1 dose of MMR. Some may require 2 doses. They recommend 2 doses for students who are going to college or its equivalent, healthcare personnel, international travelers, because you are going to be exposed to measles if you travel worldwide. Women of childbearing age should make sure that they have been vaccinated. Okay. Who does not need a vaccine? If you have written documentation of adequate vaccination, in other words, you know that you are vaccinated, you do not have to get a vaccine. Or if you have laboratory confirmation, in other words, you have circulating antibodies, it's a test, you do not need a vaccine. If you were, like me, born before 1957, you don't need it because everybody had measles. We all got the measles. And we have friends who had problems with the measles. And people who have documented evidence of receiving a live measles vaccine in the 1960s do not need to be revaccinated. And people who were vaccinated prior to 1968 who had an inactivated or killed measles vaccine or unknown type should probably get one more vaccine of a live attenuated vaccine. So there you go. Is it happening just in the U.S.? No, worldwide. People are stopping their vaccinations. I guess it's people get used to, don't see a disease and they just start not doing it. So in the UK, the uptake of childhood vaccines has decreased between 2019 and 2023 significantly. So we're not the only country that has this problem, and worldwide it's a problem. Okay, another question from my sister. Heard about norovirus. Why is it so prevalent? Well, we talked about this a little bit before. It is much higher this year than in previous years. The CDC is monitoring norovirus infections, and there's now been 495 reported outbreaks in this year, or in 2024, compared to 363 in the year before. And as we talked about last week, it looks like there's a new strain. Now, why is this important for clinicians to keep in mind? Because if you have someone comes in who's got serious gastroenteritis, you need to consider that it might be norovirus. And that's important because it's extra hygiene. If you're working in a healthcare environment and you think that someone might have norovirus, it's PPE time. You put on all the protective gear and everything. Now, for those of you who are foolish enough to want to go on a cruise, something I will never do because of norovirus, there is something called, the CDC has a program called the Vessel Sanitation Program. It was created to help the cruise industry prevent public health issues such as norovirus outbreaks. You can actually look it up and see when the latest outbreaks are. If I ever got on a boat, I'd be watching this every day. So the most recent norovirus outbreak was in a ship January 4th, 2025, just a few weeks ago. It occurred on Holland American Cruise. Overall, 4% of the passengers and 1% of the crew members reported illness. Now, if you're 96% of the people who didn't get it, you're going like, what's the big deal? I had a great time on the cruise. If you're one of the 4% who got it, you're going to be going, I will never go on a cruise again as long as I live. Once you get norovirus, you never forget it. Anyway, so here's the CDC data. You can see kind of levels. It usually comes in the winter, 2012 to 2020. Here's where we were, 2020, 24. You can see in COVID-19 years, it was very low because people were staying away from each other. And this red line is this year. So it looks like we're in for a real increase in norovirus. All right, now to the pure Q&A. I got a question. Should I assume that anything we used to call a stomach bug is norovirus? The most common cause of gastroenteritis is norovirus, but there are plenty of other causes. A bacteria can cause it, toxins, all kinds of things. So, no. Is hand sanitizer effective against norovirus? Not very. Turns out soap and water is much, much better. This is really important. Just putting hand sanitizer on, if you're on a cruise ship, ain't going to do it. Spend a lot of time using soap and water. How far are we from a vaccine? We talked about one of our experts, Mary Estes, has been working on this. But Moderna has a trial underway. So they plan to enroll 25,000 people worldwide. It'll probably take 2 years, but it'd be great to have a norovirus vaccine. Can you spread norovirus after symptoms are gone? This is a really good question somebody had. And the answer is yes. People can spread, even after their symptoms are gone, they can be infectious for up to 2 weeks. That's why it's such a problem. Okay, this is a really interesting comment I got from one of our viewers. So I read this article in the Kaiser Family Foundation, and I wanted to share it. And this is a great publication. I would highly recommend that people look at this. It was in the Kaiser Family Foundation Health News, and it talked about the origin and what's going on with the bird flu. And it was really, really interesting. And just to briefly show you some of the information out of that article, which was very good. They talked about that in the World Dairy Expo in Wisconsin in October, veterinarians were seeing a bunch of really sick dairy cattle, runny noses, udders that were wasted, very poor milk production, and looking very dehydrated. And all the farmers were trying to keep the cattle hydrated. The thing is, when that first outbreak came, it was amazing that local veterinarians were able to pick it up actually very quickly. It was identified pretty quickly by local veterinarians. And the trouble is, though, that the national programs have not really worked hard enough or fast enough to prevent it from spreading. And if you look at it now, there are almost at least 875 herds across 16 states that are positive. And the problem is that there was a lot of deference to the various agricultural oversight institutions, and we just didn't act fast enough. I've been saying this all along. I felt very strongly that we should be trying to vaccinate either cattle and or the cattle workers and poultry workers, but we didn't. And instead, right now we've spent almost $2 billion in trying to tamp it down, but I think we really haven't done a very good job. This is what a cow looks like who's infected. This is their nose. You can see them drooling, just like a really bad runny nose. And this is an example of a patient who's got conjunctivitis. So, this is when people get it from the cattle, they get this kind of disease. But if you think about what the very origin, when this first started, it only took veterinary researchers about 2 months to identify that H5N1 was the pathogen. Unfortunately, the USDA did not really step in and make, all the farm workers start testing their cattle, and this has been a really slow response. And I think part of that has been a real problem. We didn't allow. It's sort of the same thing you have with COVID. The CDC was sort of slow, and then it took all the local academic medical centers doing the testing. The veterinarians saw the H5N1 in cattle right away, but the USDA was slow to organize it, and they never engaged the local veterinarians or the farmers. And so it's really been a problem, and it's been below the radar screen. And now the trouble is there's a lot of bird flu that's flying around with cattle, and it's clear that cattle can transmit between cattle. So cattle to cattle transmission. It may have been a wild bird that started it, but right now it is spreading because of just between cattle. It could be that it's also being facilitated by the milking equipment, by boots, by local, by the handlers, but it's probably cattle to cattle transmission right now, which is a real problem. So we're really poised potentially to have a major outbreak. Right now it hasn't happened, but we're going to see. All right, now another question. I had my most recent Pfizer vaccine in March and August of 2024, just before leaving for 6 weeks abroad. I'm going to be traveling in February and March for 4 weeks and like to get another booster. While I'm in Europe, I'll be exposed a lot to my unvaccinated 3-year-old granddaughter, and so that's because the National Health System is not vaccinating children for COVID. According to the pharmacy, I normally get my vaccines here in California. I can't get another booster until the CDC and FDA approve use of an updated vaccine. Does this jibe with the information on the CDC website, and can you advise me? And okay, so, since you received 2 doses in 2024, you should be okay. And it's only been 5 months since the last one, so I actually wouldn't get another one. So, if you've gotten 2 doses, which is a recommendation, 6 months apart, within the last year, I've gone over all the epidemiology and genealogy of the virus. It hasn't changed that much. You should be fine. And the recommendation from the CDC is people who are 65 and older, vaccinated under the routine schedule, recommend to receive 2 doses of any 24-25 vaccine, Moderna, Novavax, Pfizer, separated by 6 months, regardless of their vaccine history. So that's basically, if you've been vaccinated twice in 2024-25, you should be fine. Okay, do you think COVID could reach the levels it was in 2021? It really depends on whether a new viral strain emerges. Right now, I've shown you the viral strains. The same XEC is still the dominant strain. I don't think it's changed that much. So I think, unless there's another major mutation or another recombination event, it'll probably be lower than it was back in the height of it'll definitely be lower than it was in the height of the pandemic. Okay. This is an interesting one. Next time you talk about long COVID, could you please say a word about burning mouth syndrome? A friend of mine has it. Well, it turns out I didn't know that much about it, so I had to go look it up. Burning mouth syndrome is a painful condition that's often characterized by burning, scalding, feeling, tingling in the mouth. The pain is very often accompanied by a dry mouth or an altered taste in the mouth. Very hard to diagnose. It is a primary disease. In other words, it can happen spontaneously without any other known causes. And we do know, though, that COVID can occasionally cause this. It's not a common complication, but it can happen. There are other causes, hormonal changes, diabetes, certain medications, nutritional deficiencies, reflux is another example, but it does happen. And it is a rare complication. There's also burning eye syndrome, which is another complication of COVID. It ranges from about 4% of cases. It's probably because you get a severe conjunctivitis. It's been reported as a complication of COVID infection. So it does happen. Okay. I'm a Baylor retiree, 84 years old, excited to welcome my first grandchild in May 2025. I'm up to date on flu, COVID, pneumonia, and shingles vaccine, scheduled for the RSV. Should I get a whooping cough vaccine? I didn't have the disease as a child and have never had the vaccine. Children and grandchildren have had the vaccine. I want to be able to enjoy this child without putting him at risk. Should I get whooping cough vaccine? I asked my PCP granddaughter's OB, but I think it's important to discuss, so I'm bringing it up to you. The baby is up to date on vaccines. Also, I did have measles as a child. Adults who have never received a vaccine should get a Tdap vaccine, a combination of tetanus, diphtheria, and pertussis, or whooping cough. It can be given any time, regardless of when they got their last vaccine. And to maintain protection against tetanus, diphtheria, adults should get a booster every 10 years. So yes, you should definitely get a Tdap. Okay. I don't know if I had pertussis vaccine as a child. I'm over 65. Can I get one now? Okay, as I said, this can get same issue. Can be given any time, regardless of when you had your previous vaccine, and you should be getting it every 10 years. Okay. Good questions, and it happens. Is seasonal flu a good protection during an avian flu pandemic? So this is a really interesting question that someone asked, and there's not a lot of good data on this. But there was a study from Spain that looked at a vaccine strategy should there be a bird flu pandemic. So what they suggested that probably the best, and this is done in some animals, the best vaccine strategy during the early stages of a potential avian flu pandemic would be to just get a seasonal flu vaccine, the ones we are getting this year for H3N1 and H1N1, followed when it becomes available by the avian flu vaccine. And they postulated, based on some animal studies, that it actually would provide a booster and better response than just the H5N1 vaccine alone. Hopefully, we'll have an H5N1 vaccine for everybody. Should there be an outbreak? Should there be an outbreak? Okay, if more people get the bird flu, will the virus get better at making us sicker? Well, I've talked about that a little bit, but the two big concerns are, one, that there's an animal reservoir that's the virus is replicating in. We just talked about dairy cattle, but pigs, also cats, those darn cats, and that it could mutate in those animals and then jump to humans. That is a concern that has happened. It happened with swine flu, for example. But the bigger concern is that one of these dairy cattle workers, and there's 10,000 of them, gets infected with H5N1 and also has seasonal flu, because 20% of people get seasonal flu. Now, if both of those viruses exist in a human being, it is likely, or possible, not likely, it's possible, that there'll be a recombination event that will allow the H5N1 to jump to humans. So that is really the biggest concern. And right now, there's a lot, we should be testing all those people in the dairy industry for sure. Would the disease be the same if the bird flu is inhaled versus entering the body through the mouth? Well, that's an interesting question. But there has been there has been some studies in monkeys looking at routes of administration of flu, and it turns out that if you inhale it, it's much more. The monkeys do. It's much more infectious than if they swallow it. So, the thing about swallowing it, if you swallow it in the mouth, it gets into the stomach, and the stomach has high acidity, so it probably destroys the virus. So inhaling it is definitely a bigger problem. If I feel like I may have the flu, is important to get tested to see if it's bird flu? Well, that's an interesting question. So it's always good to test to see if you have influenza, because there's many respiratory viruses out there. We've been talking about RSV, COVID. The main thing is to see if you do, what I would do is make sure you don't have COVID-19. If you can have the flu test, you can get the flu test. If you get it through a laboratory, they have your blood then, and they are busily testing the presence for H5N1. So they probably will be tested if you go through a commercial lab. Obviously, you do it at home, you'll just know if it's flu. But if it's flu, and I would just isolate myself. But if you really wanted to know, you can send it to one of those commercial labs, and they will likely test it for H5N1. Okay, this is a good one. How long will the flu season last? I wish I knew. But I have shown you some previous graphs on this. These are the various peaks of previous flu seasons dating back to 2019. And it looks like these little red dots, or the red circles, are us, and we are following exactly what happened in 2019. So if you look at 2019, it peaked in now, which is January, and it had it sort of stayed up there and didn't begin to fall until March. So if I'm guessing, I'd say it's going to be like prior to 2019. It'll end in March. It's my guess. Anyway, lots of great questions. Actually, really good questions this time. Keep sending them in. I love to answer most of my. I can answer some of them. I give it my best shot. Anyway, today I want to end with some shout-outs. If you look out there, we had snow. Now, Houston does not do snow well. And so we actually were closed down for a couple of days. And it takes a very special group of people. We have about 78, 79 people who come in, 78 or so, to come in and stay overnight. And I want to thank all those folks, the facilities, security, environmental safety, and animal care teams that stayed the last 2 nights here to make sure that our programs are all going well and science is going forward. And also all the people who stayed overnight in the hospital to take care of patients. Really appreciate all your efforts, and you deserve a lot of the credit for making things go well at our institution. So thank you all. Very heartfelt thanks. Anyway, have a wonderful weekend. I'll try and answer more questions later, Janet, and I can't wait to see you next week.